Renowned author Chimamanda Adichie has demanded accountability from Euracare Multi-Specialist Hospital in Lagos following the death of a 21-month-old son, Nkanu Nnamdi, allegedly due to medical negligence. The Lagos State Governor Babajide Sanwo-Olu has ordered a probe into the incident, which has sparked widespread public concern. In a legal notice dated January 10, Adichie and her partner accused the hospital, its anesthesiologist, and medical staff of breaching their duty of care. The child reportedly developed severe complications after sedation during medical procedures and died in the early hours of January 7. The notice, signed by Professor Kemi Pinero, SAN, alleges lapses in pediatric care, monitoring, and patient safety protocol. Oludare Marindoti is a Nigerian-trained medical doctor. He joins me now for this conversation. Thank you very much for being here. Since Adichie came out, most people have been coming out of the woodworks complaining about their experience with that particular hospital. Talk to us how risky deep sedation with propofol, in this case, in critically ill 21-month-old child. Talk to us about the implications here and the concerns being raised about the standard of care that was provided.
Thank you very much, Felicity, and thanks to everybody at home. You know, it is a sad day because nobody wants to lose a 21-month-old. And also we have to look at it from the fact that it is easy to play Monday morning striker. Osimhen should have passed the ball when you are not there, the one playing the ball. So we have to be balanced in looking at this thing. But definitely there is no denying the fact that, a tragedy has occurred, but we also have to understand what is the main cause of it. A detailed investigation is needed. Propofol, like you said, is also called Jackson juice because that was what was administered on Michael Jackson in 2009 that led to his death. And that doctor eventually went to jail and had his license revoked because why? He did his own in a house outside an hospital setting. Propofol is not a bad drug. It is a very potent drug that works fast and can wear off fast. And that is why for the procedures that they said they wanted to do, they chose to use that. It is supposed to work so fast so that they can do the MRI and then wear off very fast. And part of the problem that they are talking about, first off, informed consent, they mentioned that in the letter, that is supposed to be mandatory. So if anybody does not take an informed consent before starting that procedure, they might even lose their license. But outside that is also the monitor post the administration of the drug. The boy's vital signs, essentially oxygen concentration, heart rates, respiratory rates, should have been monitored after the administration of the drug so that when it wears off, the boy will wake up and all. But we know that there's one problem in Nigeria right now, which is the shortage of healthcare personnel, not just doctors, nurses, physiotherapists, everything. And you may want to blame it, Nigerians may want to blame it on doctors like me, that jackpot, but that is not where the problem is. The problem started when I was in part 3, when we heard the rumor that under the Obasanjo regime, when they increased the salaries of doctors were told to reduce the number of doctors they were training. And not just doctors, all healthcare sector workers across the board.
That is a bigger issue. That is a bigger issue, yes. And hopefully if we have time, we can address it. But I want you to talk to us about the response that has been given by Eurocare Specialist Hospital. On the one hand, they are empathizing with the family's grief, but they are saying that they needed to address what is circulating as inaccuracies being circulated around the child's care. And then they said, in the same statement, they said they've commenced a detailed investigation consistent with their clinical governance standards and best practices. So from your vantage point, what is the barest minimum safety requirements for, let's start with interdepartmental transfers of sedated pediatric patients, and then the response of this hospital in that regard?
Yeah, definitely. The patients should not have been, like I said, the monitoring was the most important part. And most of the times, what healthcare is a labor intensive. That was why I went to that history of what caused it, because most of people are short-staffed. So we don't know what their staff strength was at the time when that incident occurred. And in my own opinion, I would have probably even not if I was making the judgment, not done the MRI or the lumbar puncture, because when you think about it, what good would that be for a patient who is being transferred to the United States the next day? They could have just given the central line and then refer, and then the doctors here would handle the situation. But it is a sad event. We need to investigate. It is only an investigation that will probably show the toxicology report and see that the appropriate dose was given.
Does part of the statement I just read indicates an organization that's willing to put themselves through scrutiny in the ways that is required so that we don't have this scenario ever repeat itself again? I mean, looking at the statement that's been issued and the body language, as we use in local parlance, from the hospital.
Yeah, that is what you would expect from the hospital, because definitely a very prominent, globally renowned person has had a tragedy in their care. But you cannot trust the hospital to make that determination. An independent, body like the MDCN, an independent investigator is supposed to look at all the details, and then we can pinpoint it. But the problem I have is that I know Chimamanda is a globally renowned person, but she might not even get justice, assuming, and this is assuming the hospital did something wrong, because we know the way Nigeria is. I cannot tell you the number of stories of negligence that I know about that the people did not get justice, because somebody always knows somebody, and with time Nigerians get to have amnesia, and we just forget about it. I hope she can get justice. I hope the hospital is insured, because that's also very important, because you cannot bring the child back, but definitely the hospital can be punished.
We have one particular case, and that's Chimamanda Adichie, and because of her personality, this matter is in the fore. But now that her matter is out, a lot of people, like I said in my opening statement with you, that they're crawling out of the woodwork, expressing their concern about the quality of care that the hospital has given. And in her statement, Chimamanda alleged that the hospital had prior knowledge that at least 2 previous cases involving alleged anesthetic overload. We know that they are investigating. So my question would be, what would be the ideal amount of time for such an investigation to be concluded so that people will feel justice has been done? And from what you know about the Nigerian system, is that feasible?
I mean, I don't think it's feasible. Investigations like this take a lot of, details, toxicology reports. You want to know even the quality of drug. Was it a properly, we know a lot of fake drugs are in Nigeria.
Yeah, but there's a time frame. Is there no time frame that maybe legally or medically or ethically that such investigation must be concluded, no matter how technical and tedious it is?
There's no legally binding time frame for a conclusion of such an investigation. The Michael Jackson case took over 5 years because discovery and whatever, even after they knew that they had already blamed the doctor and all of this. But the most important thing is for us to get to the problem of it, because the problem that I'm thinking, and the investigation is what will reveal this, is that the boy was not properly monitored after the administration of the anesthetic agents. And if that is the case, it goes to show that healthcare is a labor-intensive business, whereby you need people, you need nurses, you need doctors to be available to be able to focus on one patient. So if that does not exist, this thing will keep on reoccurring. It will keep on reoccurring. I mean, there are so many people who have had this thing that will not even be educated enough to know. Chimamanda right now, she is exposed. Her husband, I think, is a doctor, so they know. There are so many people that have suffered from medical negligence that they don't know. Unless we can increase the number of doctors and nurses and physiotherapists and all healthcare workers that we have, we will not have the required effective number to do the appropriate management that will keep Nigerians safe, ill and hearty. And the federal government has a lot of role that they are playing in this that is negative to the development of doctors. Essentially, they just even banned accreditation of new schools when we need to train doctors and nurses. So these are things that we need to look at
quickly. I don't know whether this question is appropriate, whether you have the legal background, but you might have an idea. In 40 seconds, if you can, how critical is informed consent in emergency procedures, and what must parents legally and ethically be told?
So the informed consent is to essentially protect the doctor or the person carrying out the the procedure, and also to give the patient his right, because the patient has the right to determine, and in this case, the mother has the right to determine whether or not she wants a procedure. So that is mandatory before any procedure, whatever the procedure is. They make you sign, and that's as a little bit of indemnity for the hospital. So if this was not done, that means the patient's rights has been violated, but that means the doctor has also, or the institution has also foolishly failed to protect themselves by not giving this patient the informed consent to sign. Very important.
All right, Dr. Marindoti, thank you for obliging us tonight.